Hi, my name is Greg Fell, Director of Public Health in Sheffield. This is a situation report dated the 21st of June. Nationally first, just some really interesting data from the ONS infection survey just before the weekend that's just gone. I think I'd characterise it as hesitant optimism. The virus is increasing, the numbers and the rates are increasing, but the rate of increase is slowing. Possibly the Delta variant not running quite as hot as feared. Possibly the impact of the control measures that we've all put in place up and down the country, almost certainly not as a result of the Prime Minister's delay in step 4 that was announced a week ago today, and the timing doesn't fit, but just cautious optimism. Then I'll come to local. R is between 1.2 and 1.4, the epidemic is growing again, and accordingly our rates are beginning to go back up. It remains to be seen for how long they go up and what the rate of increase will be, but certainly going up at the moment. Almost all in under 35, not completely all, but almost all in under 35s. And almost all of the cases we see now are the Delta variant. 93% of cases are the Delta variant. So we might as well just call Delta COVID and COVID Delta. That may change at some point in the future. There may be a future variant, but for now we'll call Delta COVID. Vaccine is holding. The effectiveness seems to be holding. We're still not seeing any substantial shift in the harms coming from the rising infections. So we've got pretty well vaccinated population. There are some outbreaks in student populations. We know that will spread. We've seen that in other towns. Indoor remains much higher risk of transmission than outdoors. The core message is, sadly you've heard me say this before, are the same. If you've got symptoms, stay at home, get a test, isolate. Get vaccinated, really important that you get your second dose. And if indoors, open the windows. So the community COVID bus is an amazing and new resource travelling all over Sheffield, and is designed to be and is a one-stop shop for all things COVID, as well as offering people who don't have symptoms the opportunity to have an on-site or on-bus lateral flow device test with the results available in 30 minutes. You can also pick up boxes of lateral flow device kits to take home. You can get advice on vaccinations, pick up free resources, and get signposted to help and support, like the test and trace isolation support payment. Staff there on the bus can speak a variety of languages and are happy to help with pretty much any COVID-19 related query. And they can, as I say, they can provide advice in different languages and accessible formats. The team can also provide info about the COVID vaccine and are able to assist you in booking your vaccine if you haven't already done so. It's visiting parks, schools, businesses, community events. Keep an eye out for it. It will be advertised on our Facebook and Twitter pages to see where it's going next. If you see it out and about, go and say hello and pick up some of your testing kits. So on still needing to get tested if fully vaccinated. Now pretty much, well no, all adults aged over 18 are eligible for a vaccine, so if you haven't done so, please get booked in. Even if you've had both of your vaccinations, i.e. fully vaccinated, it's still essential that you do regular self-testing with rapid lateral flow device test. If you're fully vaccinated, you can still pick up the virus and can still infect others, so it's important that you know you do tests. Tests are done twice weekly, results are available in 30 minutes, and you can pick up the LFD test from lots and lots of locations across Sheffield, and details are on our website. If you get a positive LFD result, please book a standard PCR test. Even if you feel well, they're easy to book, and again you can do this by calling 119 or visiting nhs.uk/get tested. If the PCR test comes back positive, you must self-isolate. It is one of the most important things we can do to keep each other safe and move forward with the roadmap and keep Sheffield on the right path. Self-isolation packs are available in different languages and are there to help you plan your time and link to any support that's available to you. So on the self-isolation payment, important to remember that Sheffield has lots of support available if you have to self-isolate. Firstly, the test and trace support payment, £500, it's available to people unable to work from home, on low income and or who will lose income as a result of being told to isolate by NHS test and trace. Then we've got the local authority COVID hardship assistance scheme. It's a local scheme designed to help people in Sheffield who are having difficulty paying for food and other essentials due to COVID-19. And remember, our community helpline is still open 7 days a week and taking calls from people who need support payments I've just mentioned, and other practical things like medicine if you're needing to self-isolate, and the details are readily available on our website.